Hello, and welcome to the GoLIVE Health Foundation Health Equity Webinar Series. Thank you to all of our sponsors. Today's episode is brought to you by your friends at Microsoft. We would like to remind you that the Q&A feature will be available, so feel free to send in your questions for the panel throughout the discussion. And with that, I will turn it over to our moderator, who joins us from MITRE, Brian Anderson.
Well, thanks so much and welcome to today's health webinar on smart health cards, empowering health data utility for every patient. My name is Brian Anderson. I'll be moderating today's discussion with this fantastic group that we have, including David Rue, Rick Clow, and Amy Schoen. In a moment, I'll let them introduce themselves, but first I just wanted to say a few words about today's topic. So the first is about smart health cards. What are they? Smart health cards are paper or digital versions of your clinical information stored on a QR code. It can be information such as a vaccination history or test results. They allow you as the consumer to keep a copy of your health records on hand, easily portable, and you can share them with others if you choose. Smart health cards were the standard that was chosen by a public-private coalition called the Vaccination Credential Initiative, or VCI, that came together with the main goal of empowering individuals with an equitable, free, and privacy-preserving standard to store their health data. We believe that smart health cards were the best way to empower individuals with that kind of health data. Now, in today's discussion, we're going to focus on that equity pillar and why it is so critical for smart health cards and for VCI. You'll find that each of the panelists today has equity as one of the main drivers as part of their work in healthcare. Now, another important thing to note when we talk about smart health cards is you'll hear a lot about trust frameworks and open standards. And you may ask, what are those? Trust frameworks enable that kind of health data to be trustworthy, to be verifiable, so that you can trust it. An open standard is essentially something that's free, that's available to anyone. It's not proprietary. It's not something that you have to pay to use. It's available for everyone. And we believe that that kind of standard needs to be used for this kind of health data that we all have a right to be able to have and own. Importantly, it's also good to recognize that we've been needing immunization records for a long time. It's nothing new. If you have children, you have to show the immunization records for school enrollment. If you're looking to travel abroad to certain countries, you need to demonstrate that you've been immunized. If you need to get a job, in particular, you may need to demonstrate that you've been immunized. Now, this pandemic has certainly highlighted the need and the urgent use case to be able to have durable, portable, freely available kinds of credentials that are trustworthy, like smart health cards. The final point I'll make is that Microsoft, MITRE, and California have all been active participants in the Vaccination Credential Initiative, helping to guide and to lead that. And so you'll hear more about that in today's panel. And so with that, we'll go around the panel and I'll ask each of our panelists to introduce themselves and say a few words about the work that they're doing today. We'll go ahead and start with Rick Clow from California. Rick.
Thanks so much, Brian. It's a pleasure to be here. As Brian noted, we implemented smart health cards as part of California's digital vaccine record that we launched in June of last year. It was coincident with the relaxation of COVID restrictions that Governor Newsom implemented in mid-June. And our intention initially was simply to give California residents easy access to a digital backup copy of their CDC card. Pretty much from the day doses started getting administered in California, we started hearing from people, I put my card through the laundry, I lost it, and people wanted to know how they would be able to prove that they'd been vaccinated if they were asked. And this was what we eventually chose to do. In the 7-8 months since we launched, we've delivered 13.5 million smart health cards to about 7.25, almost 7.5 million California residents, roughly 20% of the vaccinated population in California. And as we'll talk throughout this discussion, and as Brian noted, equity really was the initial motivation for why we chose smart health cards versus any other possible solution. So I'm excited to be here and looking forward to sharing some more about what we've done in California.
Thanks, Rick. And that's just incredible work that you've been able to accomplish there in such a short amount of time. Next up, Dr. David Rue from Microsoft. David, share with us a little bit about what you've been doing over there at Microsoft.
Yeah, thanks a lot, Brian. And also, it's a pleasure to be here as well. My name is David Rue. I'm the Global Chief Medical Officer for Microsoft. I work very closely with our clients and our partners to implement technologies to improve health outcomes, improve the experiences for patients and providers. And a central piece of that is the development of platforms that are open, that allow data to be exchanged between different individuals and organizations in a secure and private manner. And interoperability is central to all of that. And certainly one of the standards that we have seen take hold is FHIR, Fast Healthcare Interoperability Resources. What we have been focusing on is the development of standards, applying them within the technology framework. One of the individuals within Microsoft has been leading the charge in terms of that, Dr. Josh Mandel, who has really been sort of the grandfather of Smart on FHIR health cards. So one of the things that we've been doing is looking at ways that those technologies can be better applied in the real world. Now, the other thing is we've seen is that technology by itself can sometimes exacerbate the digital divide. And what we've also focused on are ways that we can address some of those issues that relate to equity, finding ways that we can expand the ability for individuals to have affordable broadband through our Airband initiative, delivering essential health services to communities that are underserved through digital and non-digital means, and also empowering consumers and individuals to be able to have their own health records in their own form, whether it's a digital or a paper format, and allowing them to be able to exchange that and know that that information is verified and trustworthy. So these are the types of things that I look forward to sharing with you and getting into the further discussions.
Thanks, David. Really inspiring work. I've known what you've been doing for the past several years. It's been really incredible during this pandemic. Thanks so much for joining us. Next up is Amy Schoen. Amy, tell us a little bit about what you're doing with digital navigators and your role at Case Western.
Sure. So thanks so much for including me. I have not been a part of the panel developing the terrific smart card project, but I am a full-time digital health equity consultant. And so I'm very pleased to be able to share some of our strategies. Just to kind of tell you how I got here, my whole career is focused on health disparities and social determinants of health. And over the last decade, I was at Case Western Reserve University School of Medicine in Cleveland, Ohio. And I started a community health open data platform that was showing very viscerally through maps and virtual reality how groups of people that had the very worst health outcomes also lived in segregated and poor neighborhoods without the kind of amenities needed for good health. So just as the powerful digital health tools were becoming ubiquitous, Cleveland was named the worst connected city in America. The phenomenon of digital redlining was first recognized in Cleveland, but Cleveland also gave birth to the movement for digital inclusion that I became an early champion of. I didn't get much traction from health systems in wanting them to worry about digital equity over about 8 years. And then about 6 months into the pandemic, they started getting concerned about telehealth equity and the like. And I got enough phone calls that I quit my job a year ago and have been doing full-time digital health equity, living the dream, working with health systems, tech companies, and the like.
Well, Amy, I'm so thankful to have your voice, your perspective represented here. The dedication and history of work that you've done in this space certainly speaks for itself. So thanks so much for joining us.
Your pleasure.
Well, with those introductions done, what I'd like to now do is turn to the questions, and let's dive right into it. The first question I have is for Rick from California. Rick, tell me a little bit about, from your perspective, what is the Vaccination Credential Initiative? What are smart health cards? What are they? Why? What are we trying to accomplish in VCI, and why is it important?
Well, I'll start with smart health cards, and then I think we can sort of rewind and look at VCI as a coalition and talk about what it's meant for us in California. Smart health cards, very simply, are a framework for representing health information that is secure and it's shareable. So as a recipient, I can take possession of information that is verified, that indicates that this is in fact an authentic record. And in the case of COVID vaccines, it's an actual verified record of information that lives in the California Immunization Registry, that is the state of California asserting that Rick Clow actually received doses on these dates of, in the case of COVID, of Pfizer branded doses. So the Smart Health Card is intended to take what has historically been analog data and make it digital and make it portable. So in the case of Smart Health Cards, one of the things that was really phenomenal is over the course of last year, not only did you see multiple issuers like the state of California, pharmacies, we'll talk more about who else is issuing these in a moment, but you also saw folks like Apple and Google with Android start supporting Smart Health Cards natively as they recognized that more and more of their users were getting these records and then could share them, could store them natively on their devices. In my case, as an iPhone user, I can store my COVID vaccine record in Apple Wallet. And you heard me say shareable. So if I go to a restaurant in California that says you have to prove you've been vaccinated in order to enter indoors, I can choose to pull up Apple Wallet, tap on my vaccination record, and then display not only the human readable information that is extracted from that record, but also a QR code that is the digital representation of that same data, which can then be scanned and verified to be provably authentic as issued by the state of California and not modified. So it's not faked. It actually belongs to someone with my name, with my birthday. And I think the last bit of information for those that are new to Smart Health Cards is it is explicitly not an identity document. So you heard me say that that these doses happened to this person. It's not saying that the person holding that record is that person. The idea would then be that someone could look and say, okay, I see Rick's driver's license or passport or something, and I'm looking at him and yep, that's him. And someone with those same attributes, first name, last name, date of birth, and records actually has those doses. So it's a way of triangulating on that data, sort of a lowest common denominator representation of that information. And VCI, as the coalition that not only produced Smart Health Cards, but increasingly is helping make them more and more widely available, not just in the US, but internationally, is really a coalition of the willing. I, as the Chief Technology Innovation Officer for the state of California, am one of several members of the steering committee, trying to help ensure people understand if you're an issuer, how to go about issuing Smart Health Cards, if you're a verifier, how you could go about interpreting the information, if you're another country and you want to accept people traveling to your country who have Smart Health Cards, what do you do with that information? VCI really is intended to be the clearinghouse to ensure that all of that information is easily accessible and then acted upon.
That's great. And, Rick, I can't help but note that you were the first state, California, and the vision that you had to implement it. California was the first state to adopt Smart Health Cards at scale with a portal. What was it about Smart Health Cards that was important to you, or that spoke to you, that this was, you were a leader in this space amongst all the states? What spoke to you about Smart Health Cards that made you want to do this?
Well, I feel duty bound to point out that Louisiana actually, I think, beat us by a few hours, but we were both in the same week. So I will, the next time I go to Jazz Fest, I will make sure to raise a glass to our colleagues in Louisiana. There's a couple of things that stood out. When we proposed this to the governor, to the Department of Public Health in not quite this time last year, I think it was March or April of last year, we wanted to find a way of digitally representing COVID vaccination data. There were a couple of different ways of going about that, but one principle that felt absolutely critical to us was that it would be far easier if everyone chose the same one. If every state, if every pharmacy, if every health system, that would make it far more likely that it would be adopted. And any solution that required people to pay for it would probably make it less likely they'd choose it. And if they had to pay, they might pay for someone else's. So the fact that smart health cards were an open source framework was, for us, an absolutely fundamental building block of committing to this standard. The fact that anyone else could choose to implement and not have to pay someone made it far more likely for us. The fact that it was very, very simple also meant that it was increasingly likely that others might choose to adopt this framework. As we joked as we were looking at it, for us, from first line of code to deployment was only 6 weeks. That's a remarkably short time for any product to get built and shipped, let alone inside of government. But we joked that, like, we're only talking about 4 fields in a database. Like, this isn't rocket science. And then finally, we chose smart health cards. It was open, it was free. But I spoke briefly about equity as a driver. We felt absolutely duty bound to ensure that the state could serve as an issuer, so that it wasn't just people who had access to the wealthiest health systems that could implement the most impressive technology. We wanted to ensure that every individual in the state of California had the ability to get one of these things. And interestingly, smart health cards don't require technology. You can print a QR code on a piece of paper, on a 3x5 card, and it's just as functional. So we've had some conversations, and there have been some long-term care facilities that have started printing these out for their residents so that they have printed records that don't require them to have an Android phone or an iPhone. And for us, the fact that smart health cards checked all of those boxes really made it a very simple decision in the end.
Thanks for sharing that, Rick. So David, let's talk about trust. Trust is such a big issue when it comes to consumers thinking about sharing their health data, understanding if it's safe to share their health data with an organization or a researcher. And yet it's so important, right? It was even mentioned in President Biden's cancer moonshot about being able to enable people, consumers, to share their data. What's the best argument for why consumers should share their information? What's in it for them? How can they be persuaded to share the 4 fields that Rick had mentioned that are in their smart health cards?
So let's start with what consumers need. They need access to their health records in either a digital or paper format. They need to be able to share it with providers anywhere, anytime, or with other entities to whom they trust. And they need to make sure that that system is secure and privacy preserving. If we have all those 3 together, the individuals will feel confident that this is something that will allow them to be able to both find value and use, but also to be able to do it in a way that will ensure trust down the road. Now, smart health cards allows us to be able to do all of those. It allows us to be able to take a part of our medical record, which in this case is the vaccination status, hold on to it either in a digital format or on a paper version, and share it with healthcare providers. In fact, some of the key organizations that have adopted the smart health card framework include the major EHR vendors. So we've now got interoperable way to share information, but it's all in the context of an individual having the control of their own information as opposed to somebody else controlling their information. So this is a really fantastic way. The other thing is that from the perspective of organizations that you're sharing it with, it allows for them to understand that this information has been verified, that it's not just something that someone had shown in terms of making up a fake card or whatever, but it allows them to understand that this was a verified source. So it gives trust throughout the entire system. A really great analogy would be, if you think about it, when we go to another country, we pull out our ATM card and we want to get some cash in the currency that we're in the country. We don't think second about what's happening. You plug it in, you type in your code, and you get the cash right out of the ATM. It's incredible because what's happening on the back end, there's a trust network that's allowing us to communicate from our bank account to this bank account in this other country and allowing us to be able to get a service. That's the power of when you enable consumers to be able to have access to their health information and allow this to be done in a system that's trustworthy and verifiable. That's the promise of smart health cards.
That's great. And, you know, a lot has been spoken about this concept, David, of privacy preserving tools or techniques, and smart health cards being inherently privacy preserving or minimalist in the amount of data that's part of it. Can you say a little bit more about why consumers can trust smart health cards as a privacy preserving way of sharing their health data?
You're absolutely right. So if the first is the minimalist approach, not really looking to gather all the information, but only the amount of information that is relevant for that particular exchange. So you can share small parts or medium or larger size parts of your medical record. In this case, typically it's just a QR code that says, hey, I've been vaccinated, or that this code signifies that a vaccination has occurred. That doesn't even have your identity associated with it. It's just basically signifying that that's something that has occurred, and allows individuals to understand that you may potentially be eligible for either particular types of activities, services, travel, et cetera. But that's really what we're looking at. Empowering consumers with the ability to hold on to their information, but share as much as they want to whomever they want at any point. And it could be done digitally or on paper.
Beautifully said. So, you know, there's an exciting time in VCI right now. I'd love to take a minute just to share some news while we're on the concept of trust. So I think everyone is aware that the use case that we're in the middle of in this pandemic is enabling individuals to participate in the reopening of our economies, of our business, travel, international commerce, and the coalition's commitment to interoperability and to ensuring that this kind of framework, this trust framework, is available to everyone, is front and center. And so the news I'm excited to share is the World Health Organization is formally going to be convening a working group made up of many of the member states across the WHO and leaders of major vaccine credentials used across the globe, the major specifications used from the international perspective all over. And they've asked VCI and the leaders of smart health cards to participate in helping to develop an international trust framework and approach to ensure and enable mutual recognition as possible of vaccination credentials, and that there is a common understanding of a trust framework that would be available to everyone. So one of the main goals of this working group that the WHO is convening is to develop the playbooks and the guides and the open source standards that would enable not just countries like the United States or the European Union to participate, but countries that have less resources to be able to, again, have the open source technology and tools to be able to participate in that reopening. So we're incredibly excited to announce that news here on this webinar and to participate together with people like David and Rick and Amy and others in that WHO effort. So that's the news. And while we're talking about those kinds of countries or communities, Amy, I'd like to turn to you now. Let's talk a little bit more about equity. So a lot is said in this space about different kinds of communities, different voices that are traditionally unreached and unserved. From your perspective, who's being left out of this conversation?
Yeah, so first of all, I really applaud the work that's been done and the attention to equity that's been played. I am going to push you and challenge you a little bit on that. So, what I hear is that, well, there's a paper analog, alternative for people who don't have technology. That's great, but if that were an equitable solution, Microsoft and Apple would not be where they are right now, right? So, we all know that's inadequate. As I mentioned earlier, when the pandemic started, schools realized immediately that they had to get everyone connected, and the very students who were already falling behind were not able to participate in online schools. So schools made connectivity their problem. They didn't want to, but they had no choice. I have not seen the health and the tech sectors, embrace that. So what I hear is people saying, well, we're going to start with the given of who does or doesn't have technology and go from there. What I'm challenging you is to say, don't accept that. And now with the infrastructure bill law, there are tens of billions of dollars, not for the fiber connections and last mile construction, but for outreach and engagement and digital skill training. There has never before been any federal money for that. And now there's like more money than the people who do digital inclusion could possibly spend. So who are we talking about, to answer your actual question? Well, I know many people think that, say in just the US, that rural populations are the majority of people who aren't connected. And in fact, about 2/3 or 3/4 of people who don't have the internet live in urban areas. And so you've got seniors who have one set of reasons for not being connected that tech can do a lot about with accessibility means. But a bigger issue is digital redlining, that ISPs were not required to serve everybody in their footprint. So, you've got that. And then you've got people who have specific kinds of trust issues that are a little bit orthogonal to your framework. Think of immigrant populations who are concerned about having their information in a database because of relatives who may be undocumented or the like. Say someone who's domestic violence or someone who's been connected with the judicial system, they may be concerned about surveillance being tracked. So these are kinds of trust issues. People who don't have broadband at home rely on smartphones. They often don't have data plans, so they tend to use public Wi-Fi that they know is not secure. They know that their data are at risk, but they kind of have no choice. Seniors, they are getting on board with recognizing the trust, that they shouldn't have trust. Even my own dear mother in her mid-80s, an early adopter of technology, was completely scammed by somebody who targeted the senior residence where she lives. And so these are real issues that I think have to intersect with trust as the way you think about it.
It's a lot to unpack there, Amy. Help me understand what would happen. So we've launched Smart Health Cards. We've launched this amazing coalition within BCI. What's at stake if we don't continue to put the priority of equity front and center and look to try to answer and grapple with those questions? Like, I'll tell you honestly, one of the questions that I've grappled with is, you brought up, so illegal immigrants that might have a significant concern around trust. David, we were just talking about, what happens if we're not asking those questions and frankly answering those questions?
Yeah, I think that we will risk just continuing to exacerbate health disparities and frankly further undermine trust. I mean, people who are poor and have been bypassed by the internet and have no possibility of jumping on economic opportunity bandwagon that technology represents, if and they are, of course, the people who were worst affected by the pandemic because they couldn't work from home. And so, I think we just risk further pushing people apart into the haves and have-nots. Now, I'd love to talk about ways that we can address that, but I know that's for another time.
Well, no, I think we're going to possibly maybe touch upon one of those here. So, one of the areas you talked about was that last mile about broadband and the role that broadband plays in health equity. I'd like to invite Rick into this conversation. And so, Rick and Amy, we know broadband access is a super determinant of health. It downstream has so many implications in terms of education and access to care. But do we even need broadband, particularly when it comes to smart health cards? We're talking about smartphone technology or a printed out QR code. What role should the government play versus private industry in making broadband available? We're curious if you have thoughts, or Amy, curious if you have thoughts on that. And frankly, is it even possible to achieve health equity in the US without ubiquitous access to broadband? A lot of questions. I'll start there with Rick.
Okay, well, so a couple of things I think are worth pulling on the thread here. First off, I think Amy raises some absolutely critical points. Things like a number of people who are vaccinated in California are undocumented residents here in California. It was critical in the design of our system that we not require you to have information that would only be accessible to documented residents, i.e. a driver's license, a passport, things that might be easily available to me as someone born in the United States and a licensed driver and a passport holder, et cetera. But it is arguably at least, if not more, important to vaccinate communities that, for instance, farmers in the Central Valley, who the state was actively creating mass vaccination clinics to ensure that all farm workers in the Central Valley were vaccinated. If they couldn't easily get access to this because they needed to then present a driver's license, which they might not have, then we would have failed, and we would have absolutely, as Amy suggested, created a digital have not situation. So one of the things we loved about the Smart Health Card framework was that because it's not an identity document, we didn't need to try and blend this with other systems. We could keep it exclusively focused on just the vaccination record. And then the ability to deliver it to an individual does not require broadband access. And because it's delivered securely through a browser, that if you're on public Wi-Fi, the actual communication of that data is itself encrypted. So nothing is communicated in the clear that puts any information encoded in the Smart Health Card, like your date of birth, at risk. As far as your comments, Brian, about broadband, incidentally, at the same time that the state of California was leading on Smart Health Cards, Governor Newsom put several $1 billion towards bringing broadband to underserved communities throughout the state of California. It's a multi-billion-dollar initiative that is currently underway. The first 10 communities were selected. And it's amazing as I hear Amy laying out some of the foundation on which the answers need to be built. 2 of the 10 are urban areas. One is in Oakland, one is in Fresno, and then several others are in much more remote communities throughout California. The intention is that every California resident get access to broadband. I would say, however, I said incidentally, that's not related to our commitment to Smart Health Cards. The final note I will say that is something we adored about this approach is that it doesn't require live internet access to be useful. Once you have the record, it is in your wallet on a piece of paper, or it is stored on your device. It doesn't need online constant access. So you go to a restaurant, you want to show it, it is physically on your device. It is stored locally. So I think in that regard, I'm by no means the health policy professional. I will leave it to the experts to talk about health equity and whether or not broadband is a requirement. But I do think that fortunately, at least in California, we're making progress on both fronts, even though I think ultimately they are on parallel paths, not intersecting paths.
Great. Amy, what was your thoughts, reaction to what Rick just shared?
Yeah, so let's take the question of broadband, kind of, is it necessary in the era of smartphones, and particularly with the smart card application that's obviously optimized for a smartphone. I think the question has to be asked, with or broadband. Well, I would say that over the last 5 years or so, there has been an absolute consensus of the digital inclusion community that broadband in the home is absolutely essential. With fixed broadband or fixed wireless broadband, you usually have unlimited data, and the connection is much, much faster than, if you're only working on a smartphone. Poor people, yes, everybody and his mother has a phone, but poor people do not have data plans on their phones. And so, the other thing about the home broadband is with that, you have you can use a device with a full screen and full size keyboard. And those are not only essential for building skills, but they're essential for leveraging the full power of the internet for economic transformation, which is what's fundamental to equity. You cannot write a term paper, write a resume very effectively on a smartphone. So I'm really trying to evangelize tech companies, health systems, everyone. Don't just focus on how can I get people able to use, my smartphone app, but back up to make sure that they're fully empowered to be part of the digital economy. Did that answer your question?
Yeah, absolutely did. And you reminded me of all the term papers I wrote on Microsoft Word. And it just so happens we have David from Microsoft here. David, would love your thoughts on where is Microsoft in this last mile of broadband to those that need it most, and some of the work that you're doing there.
Yeah, so we've been thinking about this for quite some time. We initiated about 5 years ago the Airband initiative to provide affordable broadband access across not only the United States, but also globally. Had identified some key issues that Amy's highlighted. The first was that there was really an underappreciation of how big the problem was and where it was. Originally, the FCC had identified 18 million people in the United States that didn't have access to broadband. More recent research has indicated that it's probably closer to about 157 million. We're now talking not just in rural areas, but also in urban areas. What we have to do is we have to really understand geographically where they're located. So more accurate maps are absolutely a critical part of this. Now, the other thing is public-private partnerships. Now, that has been our primary effort to bring together organizations to provide incentives, but this is not a one company type of initiative. This has really got to be something that, as Amy had indicated, needs to be part of infrastructure, critical infrastructure for the nation and the world. And what we can do is we can build off of the work that we've done. In the United States, we've expanded affordable broadband to 1.5 million individuals. Globally, it's actually been 14 million, so had a bigger impact even outside of the US. But if we have that infrastructure in place, it allows us to be able to move to that next level. Now, I want to also add that when you think about health equity, access to care is probably one of the first steps, but not the only step. We saw this during the pandemic when we thought, well, we're going to have these mass vaccination sites and we'll have pop-up clinics in the local neighborhoods. Well, surprise, surprise, we hit a plateau. And the reason why was because people didn't have trust. They didn't have trust in the system. They didn't have trust in the government. They didn't even have trust in the healthcare providers. There was not that level of trust around what is it that you're providing and what are you going to be doing with that information. But really, it was about just initially, I don't want the vaccine, or I have questions about the vaccine, or no one's talked to me about this. And what we realized was that if we're going to go and tackle these issues around health equity, we're going to have technology, but we're going to also have to have an ability to empower communities to be able to have discussions with the people in their communities, address their concerns, and allow us to be able to work together to be able to apply the technology in the most meaningful way. And I think that has been one of the biggest learnings that we've had, is that we are definitely an enabler, but we are not the star of the show. The star of the show are the people that work in the communities and live in the communities and that understand the issues and allow them to be able to apply the technology in ways that work for them.
That's great to hear. I'm curious, David, just to stick with you for a minute. So, oftentimes when those of us that are in the digital health space get very excited about a new technology or a new tool or a new initiative, it always comes at the cost of creating risk to exacerbate those inequities. It sounds like what you're speaking to is connecting with the communities that you're hoping to serve where they're at in a way that's meaningful to build that kind of trust, to not exacerbate those inequities. Am I capturing that right?
And that's the starting point, because from that, we'll learn what those barriers are and issues are, and then we'll build off of that. So some of the things that we have heard and we've already started implementing is, sure, you've given me access to the internet, but I have no idea even how to use it, or I don't even know what this information means. So digital literacy, healthcare literacy, these are all building blocks that allow people to be able to successfully navigate. And then providing that level of support, and the organizations that work with the people on a day-to-day basis are best able to provide that trustworthy information. Now, we can provide the infrastructure and a lot of the tools and resources that will help support those individuals, but it's really about supporting and empowering communities.
That's a great point. So, Amy, I'm curious what your thoughts are, particularly with what David just said. The technology is thus the tool, but it's really about empowering the individuals in the communities. Curious what you've been working on with the digital navigators, and maybe share a little bit about, what is all this telling us about where to go with smart health cards and ensuring that we're not exacerbating inequities.
Yeah. So, David, we're singing from the same prayer book there on partnering with communities. I really want to call your attention to the National Digital Inclusion Alliance that has been toiling away in obscurity for 8 or so years until the pandemic came along. They just had their first in-person meeting again after the pandemic, and it was an electrically charged event. They have over 800 affiliates around the country who are those trusted community organizations that have been working on getting people connected and digitally skilled. So NDIA was actually the authors of the Digital Equity Act that's in the infrastructure law. And they're developing this model of digital navigators who are people who are trained to find out what someone's gaps are and help them figure out the best way of filling those gaps. Now, community health workers, I believe, represent the optimal kind of workforce to engage for that, because they come from the communities of the people they're working with. They understand what the barriers are, and they know how to talk to people in ways that, inspire trust. So I would ask, I really want the firepower from health and technology brought to bear on this problem, but don't take it away from them. Work with the community organizations. They do not have the bandwidth to fully take advantage of the tens of billions of dollars that are now going to flow to this. So technology can really help, but please don't be too helpful.
That's an appropriate call to action, Amy. I appreciate that. So, Rick, I'm curious, from your perspective as one of the leaders of the Vaccination Credential initiative, how is VCI addressing this?
I mean, ensuring that the framework remains open is, I think, a critical first step. Absolutely, anyone that wants to be able to issue a smart health card should be able to. And then ensuring through the work that you referred to earlier with the WHO, ensuring that anyone that has a smart health card can take advantage of it, right? So that we don't have some tiered system where some smart health cards are somehow better than others. If it's a valid smart health card issued by a known issuer, everyone possessing a smart health card should be able to enjoy whatever benefit from presenting it would accrue. I think ensuring that it continues to be as little information as possible necessary to achieve its purpose is also critical, so that we don't start stuffing things into the smart health card that aren't required for a COVID vaccine, but it might be nice to have that could create some unexpected outcomes or edge cases along the lines of what Amy's referring to. Ensuring that it is designed for a purpose, that it is delivering on that purpose, but no more, so that we can't create scenarios where data can be exfiltrated or dossiers can be built outside of the smart health card, stored locally on the user's device or on a piece of paper. I think ultimately it's incumbent upon us at the VCI to ensure that the reasons that folks like us in California and others initially saw it as such a terrific foundation for enabling equitable access, that it remains that as we continue to explore how it might serve all vaccination records as opposed to just the COVID vaccine currently, because the more portable and usable this data is, the more it will serve, I think, the goals that Amy is articulating, and certainly what I consider my responsibility as a part of the steering committee.
That's great. You know, Rick, you bring up such a good point about the minimal amount of data necessary to accomplish the use case. One of the things that excites me about smart health cards is certainly the use case in front of us, right? The COVID vaccination credential that's verifiable, that's trustworthy, that's portable, that's free. But, you know, when you look at the runway of potential opportunities to empower individuals with other parts of their health record, you know, one of the questions that I ask myself also on VCI is, how do we do that in a way that maintains that minimalist, privacy preserving manner of ensuring that we're both empowering individuals, but protecting them from, you know, others collecting dossiers on them, as you indicated. I think that when I think of the use cases for smart health cards beyond COVID, you know, there are, you know, the ones that jump out to me certainly are vaccination credentials other than COVID, right? Enabling parents, all of us that have kids that are enrolling our children in school, to be able to have the kinds of easy access to that kind of credential, so we don't always have to go back to the pediatrician to get the copy of the record that I know I at least always lose. But even more, enabling individuals to have trustworthy copies of their health records, right? I know that many companies, Microsoft, you know, great example, David, some of the work that you guys are doing, empowering individuals to be able to have, you know, highly portable access to their health records to take wherever they want, to go to an urgent care, to go to another health system, to share for research purposes. Those are the use cases that, you know, excite me. You know, David, I'd love to, you know, turn to and maybe shine a light on one of those use case stakeholders, public health, right? Let's talk about public health for a minute. Certainly in this pandemic, I think we can all appreciate that, you know, it's been crystal clear that the US has not invested in the public health infrastructure that we may have wanted when we entered into this pandemic. Talk to me a little bit about both the work you've been doing with public health authorities, but I think more to the point, how smart health cards have shown a light on how we can empower public health authorities, work with public health authorities to improve the kind of infrastructure to create a more resilient society moving forward for the new pandemic, for the next pandemic.
Well, I think early in the pandemic, we saw one of the biggest challenges were on the healthcare provider side, the inability for healthcare organizations to be able to share critical information in a timely manner, such as PPE, bed availability, ICU, ventilators. And we were able to, in very short order, implement FHIR as an interoperability standard that allowed us to be able to then provide sharing within communities and cities and even states. That was highlighting the need for us to adopt and continue to push forward for interoperability within healthcare. But we also saw on the other end, public health needed to coordinate their efforts with healthcare because a lot of this was around infection rates and vaccination status, especially in underserved areas. And what we have now is an ability where that can be done with empowering consumers with their own health records. The Smart Health Card framework adopting the same FHIR standards, allowing people to be able to be in charge of their information. Now, why is that important? Imagine if you went to your first vaccination site and it was at a mass vaccination site done we'll say sponsored by your county. And then you go for your second vaccination at your healthcare provider, your primary care physician, and they have no record of the first one. Well, if you have your smart health cards, you can go, it doesn't even matter, even if it's in with the same state or where elsewhere, it allows you to be able to then have that level of control and ability to share and update your information. And that's so critical because it allows us to be able to then enable consumers to be able to basically manage their care. And what we're looking at is from a perspective of who has control of your own information. Let's get the consumers and the individuals that really should have a complete record, access to that record in whatever format they want, and then the ability for them to share in an easy manner with those individuals in a secure, verifiable manner. That is something that we've been talking about for quite some time, and we've been trying to build in structures where healthcare organizations can communicate with public health, and that's going to need to continue. But the other path forward is allowing consumers to be able to have that information and control.
That new channel of engagement will be so powerful. I agree moving forward, David. That's important work. So I want to transition to make sure we get to questions. I see a number of questions coming through the audience. So before we do that, though, I'd like to ask each of the panelists your closing remarks as we begin to wrap up this webinar. Your thoughts on where we go from here as it relates to broadband access, equity, smart health cards. Let's go ahead and start with Amy.
Sure, thanks. And what a terrific group of people and thoughts today. First of all, I would challenge you all to become champions of digital inclusion. That means setting goals within your organization around digital equity and creating metrics so that you're tracking your progress. Partnering with community organizations that are trusted by people who've been digitally excluded, but go to their tables. Don't expect them to come to your tables, and make sure that your solutions are solving their problems. Look for the win-win, and then you'll get their cooperation and move everyone up the chain of digitally engaged and empowered.
Great. David.
So technology can solve a lot of problems, but when we talk about health equity, we have to go above and beyond what we currently do to address the underserved, the vulnerable, those that are disadvantaged. In order to do that, we have to start looking at the most basic building blocks: digital infrastructure, affordable broadband access, build off of that with digital literacy and healthcare literacy, enable public-private partnerships to help support these organizations and these individuals, and then allow us to be able to make everything seamless with the consumer in charge. If we do all these things, we're going to make a huge strides in achieving health equity.
Great. Thanks, David. Rick.
I mean, I think you could say that we were inspired by the work that VCI did before we became a part of it in committing to an open standard to try and address, among other things, equitable access to this information. After we launched our digital vaccine record system in June, shortly thereafter, we launched our own code, our implementation of smart health cards, to the public domain, inviting absolutely anyone that was interested in doing something similar to launch their own systems. And those systems are now live in the state of Washington and Washington, DC. We have at least 3 other states who intend to implement our code in their system. So for us, it was part of our commitment to ensure that this was as accessible as possible, literally at no cost, to ensure that more and more people could have access to this technology, which I hope will invite other participants in the ecosystem to start to assume that this is one of the building blocks that they can then extend.
Great words, Rick. So as we transition to the question period, I want to make sure that I cover a few websites that if you're interested, if you've been inspired by what you've heard today, and you want to learn more about smart health cards, if you're a general user or a consumer out there, go to smarthealth.cards to learn more about the open source standard, see a list of issuers, get a sneak peek at what some of the folks like those Rick in California and elsewhere are doing in this space. If you're an organization, a company that wants to become a member of the growing coalition that is leveraging smart health cards, you can go to vci.org. That's the coalition's website. And if you're interested in learning more about public health innovation in general, the work that Amy is leading in her space, go to Public Health Innovators, one word, publichealthinnovators.com. And for those of you interested in understanding, really frankly, some of the very inspiring work that David and others are working with communities across the world in healthcare strategy for Microsoft, go to aka.ms/cloud for healthcare, one word, aka.ms/cloud for healthcare. All right, with that, I think we have a minute or two to get into some of these questions. I'm going to go into the first question, and David, this one is for you. It comes from Robert. Can the equity be achieved by providing the services for free? And I think the services being issuing smart health cards.
Yeah, so clearly when you talk about who pays for it, you cannot be asking the individuals that are suffering or needing it the most to be flipping the bill for this. What we have to figure out is how do we create a sustainable business model where organizations can come in and provide this. Right now, a lot of it's done through philanthropic efforts, but we have to start looking at how we build this in as infrastructure that supports. And that means prioritization. We have to prioritize the health of those that are underserved and those that are underrepresented. And through that mechanism, we can build in mechanisms that support this on a long-term basis. So I have no doubt that we can come together and do things on a short-term basis. The question is sustainability, and we have to create the business models, incentives that allow for that.
Well, fantastic. I realize that we're at time and I want to be sensitive to folks' time. And so what we'll do is we'll commit to trying to reach out and get answers to all of the remaining questions for the audience members that have open questions here. I apologize that we weren't able to get to everyone's question. I really appreciate my panelists' time. This has been a fantastic conversation. David, Rick, Amy, thank you so much for your time. Thank you for our sponsors from Health for putting on this webinar and for allowing us to share a little bit about why equity is so important for the Smart Health Card Initiative and for those of us within the Vaccination Credential Initiative. Thank you, everyone, and have a great rest of your day.
Thank you to Brian and all of our panelists. Please visit our website at hlth.com to catch up on all Health GoLIVE webinars. And join us at the inaugural VIVE event, the industry's new health information technology event, coming to Miami Beach, March 6th through 9th, 2022.